Hello and welcome everyone to the 10th episode on Thinkers Unlimited. And today's guest is someone I have had the privilege of working under his inspiring leadership in UAE. And the guest is none other than Dr. Raza Siddiqui. Visionary, healthcare stalwart, and business leader are some of the ways to describe him. Passion, creativity, innovation, and leadership are some of the words that define Dr. Siddiqui and lend him the unique ability which distinguishes him from many other in the business. During his illustrious career spanning over 4 decades, he has successfully driven many high-profile projects and bagged various awards and accolades for his pioneering work in the healthcare domain. Dr. Raza began his career at acclaimed pharmaceutical companies such as Ranbaxy and Lupin Laboratories. Today, he heads Arabian Healthcare Group, one of the leading healthcare groups of UAE, besides being executive director of the premium RAC hospital in Ras Al Khaimah. From choreographing the launch of Apollo hospitals in India to establishing Bellhall Speciality Hospital and RAC Hospital in UAE and turning them into profitable ventures within a quick span, he has been instrumental in setting up several other multi-speciality hospitals with international collaborations, diagnostic laboratories, and also a medical college. His forte lies in promoting countries and institutions as medical tourism destinations, and he has done commendable work within this domain by promoting UAE and bolstering RAC Hospital as the place of choice for medical tourists. Amongst the current position he holds are board member of RAC Medical and Health Sciences University, RAC Hospital and Arabian Healthcare Group, advisory board member for CEO Club International and Arab Health 2020, first Indian board member of RAC Chamber of Commerce and Industry, and founding board member of UN Office for Disaster Risk Reduction. Amongst the lot of awards that he has won, few of them are the International Business Achiever CEO Forum Mumbai 2020, CEO of the Year Global Healthcare and Medical Tourism Conclave 2019, top 30 Indian executives in the Arab world 2018 with a rank 26, World Medical Council Excellence Award Hall of Fame in 2019, Most Influential CEO of the Year Award 2018 by the CEO Clubs Network, and a token of appreciation by His Highness Sheikh Saud bin Sakar Al Qasmi, the ruler of RAC and member of Supreme Council, for serving as the member of the board of directors in the RAC Chamber of Commerce since 2013. Thanks, Dr. Raza, for accepting my invite and joining me for today's discussion on Thinkers Unlimited.
Thank you very much, Prashant. It is a pleasure. It was always a pleasure to be with you in the past when we have worked. And thank you very much for giving me this opportunity. And thank you very much for the kind words you have used in my introduction.
So let's get this conversation started. Where do you see the future of healthcare marketing evolving into, especially keeping in mind the impact of COVID-19 on this sector and everything else?
Very interesting question. Thank you very much. And as you know, by core, I'm a marketing person. And I take pride that I started my career in pharma marketing. And I'm also a fashion designer. So in between, I moved into fashion designing for 8 years. And then finally came into hospital marketing once again with the launch of Apollo Hospital Delhi. So for me, the healthcare marketing, healthcare PR, healthcare promotion is very, very important because creating awareness, creating a lot of consciousness in communities and societies is very, very important. Now, the present situation is, everybody is aware of this. COVID has changed everything. It is perhaps one of the most challenging times for all of us, and more so for healthcare industry, because this is for the first time in the history of the world that one disaster like this has practically shut down every business and impacted everybody's life in some way or the other. So has healthcare has also been affected heavily by this. Now, on one hand, we have a big challenge managing COVID situations in the hospital. At the same time, we have to keep the business alive, and we have to keep the conventional routine stream of patients coming to hospital. So in this situation, the typical, like for example, typically in healthcare marketing, we used to go to doctors and to connect them to the hospital for referrals. The typical marketing teams used to connect with the corporates and do some corporate awareness programs in person, do some insurance marketings, do some PRs. But now, with the situation, the physical interaction, the relationship building does not exist, and is a big challenge. And everybody's conscious, everybody's fearful. It is a big challenge. So what we call is new normal. New normal is also coming in healthcare marketing. So I think from the typical above the line, below the line, medical marketing, everything has to move to digital platform. Like for example, the main connect was the CMEs for doctors, and doctors actually used to enjoy the CMEs, and this was a great opportunity for socializing, for for interacting and exchanging of ideas. Now this most important education and case sharing platform has totally moved to digital platform. So the one of the most important aspects of marketing, which was medical education, has to move to digital platforms. And now we have seen some of the companies have done a great job, and you don't really miss except physical interaction. They create live platforms for everything. And same is for corporate marketing. Like for a corporate marketing, you have to bring in a lot of innovation. Like I will give an example. When COVID started, we had a big challenge, because then we had to come up with some innovative ideas to support our corporate partners. And we call it Partners Program and Partners Association. So what we realized was that this is highly contagious and infectious situation. I'm giving you examples of innovation in marketing. So what we did was we helped them with something called hygiene audit, unheard of. So what we did was we formed teams. We formed teams headed by our quality manager, infection control nurse, and some other supporting staff from the hospital. The entire team will go to the workplace and do hygiene audit in the desks, desktops, keyboards, kitchen surfaces, door handles, just to create awareness and consciousness about the existing microbes in those environments. And those potential surfaces could become ground for COVID virus also. So the results were amazing, and we found a lot of areas where we could support the organization. So this is sort of I call it opportunities in adversities. When people were finding it challenging to engage with the corporates, you come up with some innovative ideas. It is all about helping them in surviving better and making workplaces more safe. So what happened was that we generated so much goodwill with everybody that they realized that they are not only here for business, And they are not only waiting for our people to fall sick and give them treatment and make billing, but also they are available to us in adverse situations like this. So then we also organized awareness programs for them online. Then over a period of time, when the PCR testing started coming, then we started online education to the staff for periodic testing. Then when the vaccination started, we started educating them because the anti-vaxxers lobby was also equally strong. So there people had so many questions, and they were not finding answers which they wanted. So we organized. So what I'm saying is that it is an ongoing and long discussion, but this is where the innovation has to go into healthcare marketing. So we have to find innovative ways to come out of the conventional marketing and come up with new ideas. Another idea, what we did was that uh, millions, hundreds of millions of people have been affected by COVID all over the world. And uh, some of the lucky people have come out. Most of the lucky people have come out. Some of them have lost lives, but most of the people who have come out have medical issues, have psychological issues, have emotional issues. So we tied up with United Nations, UNDRR, and came up with one of the top COVID rehabilitation programs. And so this is again innovative marketing in healthcare. So every fortnight we have somebody like medical physiotherapist, nutritionist, talking to people and taking their questions and applying it to them. So the typical conventional medical marketing has to move uh, from the stereotype and come up with innovation and to be able to continue meaningfully and engage the business partners and keep helping them, because it is not only marketing and selling. It is to be genuinely with them and to work with them to genuinely find meaningful solutions for their problems, so that they trust you more, they believe in you more, and they remain your partners for life. Because anybody who is genuinely with them in these challenging times is the meaningful partner. So when they have a situation, you have helped them. When they have a disease, unfortunately, they will also come to you for the meaningful solutions. So I feel that we have to move from stereotype, we have to evolve. And again, it is all about caring people, providing them meaningful solutions, and to be with them in difficult times.
That's a lot of, I will say, food for thought for the marketing heads in hospitals across the world, of how empathetically you take the relationship marketing to the next level. And I'm sure that will have a long-lasting impact in strengthening the relations between the providers and these other people who are sending patients to. That's wonderful. So now, because you are, I'll say, a healthcare marketing guru, what is your advice for the medical value travel companies and providers in India? And what do you foresee the future of this in the coming years, for especially for the Indian market?
Prashant, you may know that I am one of the few people who is blessed and is lucky to start the campaign India as Medical Tourism Destination. And the credit goes to my mentor, Dr. Pratap Reddy, the founder of Apollo Hospitals. And I'm blessed, and I take this is my special privilege that I've worked very closely with him for 10 years. And when he started this campaign, and that time he could foresee that India will become the ultimate destination for medical tourism for the world. And so many things to learn from that man, not that man, that institution called Dr. Pratap Reddy. And you know, he taught me so many things which are so meaningful. Like, for example, he said that alone you cannot do it. The entire ecosystem has to support it. Apollo alone cannot do it. All the other healthcare providers, all the healthcare groups have to come together and be part of this campaign and this initiative to promote India as a medical tourism destination. So all of us who are part of this ecosystem have to work on this with a vision and with a plan. So marketing alone cannot be the only driver. On the ground, everybody has to support this initiative. Like, for example, I will give you UAE example, and then we will talk about India. Like, I'm very lucky and very fortunate to be part of this healthcare system for 20 years. So I know both India and UAE here. Nobody was prepared to handle this situation. What we witnessed here is unimaginable. So this was a unique public-private partnership. And everybody got together under the umbrella of the government. And what we typically conventionally call PPE in so many things, but it was real public-private partnership here. Right from hygiene, right from PCR testing, right to the best treatment possible to people. So what happened in the beginning? All the hospitals became COVID hospitals. And the real patients, the cardiac patient, the neuro patient, the cancer patients, the gynae patients, the orthopedic patient had to suffer. So what government did was, government realized it, and government slowly moved COVID patients from private healthcare. They converted all 5-star hotels into quarantine centers, and they made field COVID hospitals. So slowly they decongested the private healthcare to be available for all the elective and normal procedures, and made government hospitals as COVID hospitals, made hotels as quarantine centers, and made field hospitals for other masses. So the ecosystem worked towards it. Now what happened? Same time, the entire city was disinfected, sanitized. So I'm talking about holistically the ecosystem. This gave a lot of confidence to international patients because they realized there is a country where everything is falling in place systematically in a way which is most friendly for me. So now airports were sanitized, airlines started promoting. So slowly what happened is patients started developing confidence in taking a step out of their home. And this became a destination of choice. You will be surprised. In the past few months, we have seen hundreds of patients coming back from Africa and GCC into our hospitals. So it is the ecosystem which has to support. In India today, we have a situation. We had a situation, now situation has improved, that everybody had to support. Every hospital, private and government, became COVID hospitals because there was no choice. Because by sheer size of the country is so big, the population density is so high, and to take initiative, it is very hard there because different tiers of society, awareness levels, lot of things. So every hospital has become COVID hospital. Government had no choice but to put conditions that 80% of the beds have to be converted, which has created a lot of discomfort, and a lot of international patients who have faith in Indian healthcare system, they are confused what to do. So I think the entire ecosystem has to learn from the past experience, the entire initiatives have to be repositioned. And we will talk about it during the discussion, because I am a firm believer that the biggest lesson to learn from this pandemic and to bring the confidence back of local and international clients, it is very, very important to once again relook at the model of single specialty, because and it is also very important to look at the use of technology. Like, for example, I will give you example of UAE. You have been part of the system for many years and you know it. Here, the typical business is 70% is outpatient, 30% is inpatient. Because of the population mix, because the population above 50 years of age hardly is 5% in these countries. So uh, the hospitals had outpatient capacity when COVID uh, struck all of a sudden. But everybody was shocked and patients were so much scared, they stopped coming to hospital. So we had capacity, we had physicians, we had specialist consultants available. Neither the patients could come to hospital nor the physicians could provide and come to hospital, because COVID does not require, as you know, specialized care. It is maintenance or ICU care. So you don't require an orthopedic surgeon, you don't require a full-time neuro, cardio, all these are supportive in case of complications, but they have their capacities available. Same is if your wife has to deliver, you will think 100 times to take her to a hospital, because you see everybody is a COVID patient there. So at that time, if we had single specialty hospitals, and which had sort of a firewall there, and you are only going to an orthopedic hospital, you are going only to a cardiac hospital, you are going to a mother and child center, you are going to a specialized dental center. So all these businesses which were heavily affected by this could have continued to provide the required and desired standard quality healthcare to all their clients. So clients would have benefited and the business would have survived, because business has suffered so much. So we could have avoided. So I think these are the few challenges and few lessons which we have learned out of this, and with which we have to relook at the future of the healthcare in every way. So coming back to your question of medical value travel, first of all, the ecosystem, the cart has to be ready. The marketing is horse. Horse will come later. You have to have the ecosystem ready to once again accept the patient in a fearless environment, so that he could, because India is the destination of the world, in my words, for tertiary and quaternary care. And I am a proud Indian, and I would always take pride in saying this, that the most cost-efficient quality healthcare, if somebody wants, India is the choice for this region. Because for such an amount which India is charging, I don't think anybody can think of providing that level of care, like the likes of liver transplant, to joint replacement, to cardiac surgeries, to bone marrow transplant, everything. And mashallah, the outcomes are so good, and doctors and hospitals have earned such a good name internationally. But I think all the ecosystem has to come together and start relooking at and building blocks for the comfort of international and domestic patients. Then the marketing will work with the message, because marketing is the messenger for a good product, but the product has to take shape once again and then move forward.
I think messages for the healthcare providers to the government, I think to wake up now and be prepared that once this wave is dissipated, that we are much readier than what we have in the past. And as you said, that to make that goal fulfilled of being the number one provider across the world for MVT. And I'm sure that if everything falls into place, we can achieve that. Or something that we've been associated with the UAE healthcare for such a long time, and you've been looking at it very closely. So do you think that the UAE healthcare market is oversupplied, keeping in mind the population size and the presence of the number of beds? Do you foresee growth in this sector to be bullish in the coming 3 to 5 years?
I think now in this situation, UAE is in prime position to become a medical tourism destination. And also, UAE has achieved self-sufficiency in almost every specialty up to a tertiary care level. So in terms of, I mean, I've been lucky, I've witnessed the transformation. When I came here, the population was 2.5 billion and huge amount of money was being spent on treatment overseas. People were traveling to every country possible for small treatments. And I've seen this country today not only becoming self-sufficient, but also attracting almost more than 1,000 medical tourists every day. So this is a big transformation. Coming to your question of supply and demand, I think we still have great opportunity here in many ways for domestic and international, because if you see the supply of beds is still one bed for 550 population. So conventionally, as healthcare administrators, we know that the best ratio is not, the desired ratio is one bed for 250. So practically the 15,000 beds which we have now have a potential of getting doubled over a period of time. So in next 5 to 10 years, you may need 10 to 15,000 beds more in UAE. Now the obvious question is how it is being served presently. So the answer is that today you are dealing majority with young population. But now over a period of time, we have moved into second and third generations of expats here. So like, for example, my children who have lived here find it home. So they may continue to be here. I was thinking of going back to India, but I'm rethinking now that if my children are going to be here, I better stay here. So what is going to happen is that this mix is going to change, and you are going to have a growth in aging population. So population above the age of 50, 55, which is 5 to 10% now, in times to come may become 25, 30, 40. So the demand, local demand will go up because that is the age group which requires more IP care. So the number of beds which is typically projected to be doubled, there is a potential because of the aging population. And second thing is, I am a big promoter and I do full-time, I do KC for investment into hospitals rather than 5-star hotels. Because UAE is tourism economy. But if I do the calculation, as per the published data, the revenue per 5-star hotel room is close to 700 dirhams, which is almost $200. But once we see the potential of business, healthcare business in tertiary care, the per bed revenue is almost more than $1,000. So the investment to do a hotel, 5-star hotel room and to do a hospital, I'm purely talking from business investment point of view. With the social other angles of healthcare are different, because so many people can question me that health is the responsibility of the state. But the times have changed now, because all over the world, governments have realized that healthcare cannot be provided free or subsidized. because it is capital intensive and technology intensive. So it has to be run as an efficient business. So there is a huge potential in Dubai as a next medical tourism hub or a destination over a period of time. So there again, there is a huge potential for investment into hospitals to attract international medical travelers. India will always remain a prime destination. This can become a destination, say, for business class medical tours who want, I always believe, and top of the line, you know our tagline, premium healthcare and premium hospitality at RAC Hospital. This has a meaning because we designed this hospital to become a destination for the region. So that hospitality aspect is very important, and Dubai is very well known for that. Dubai has redefined the hospitality standards. If same could be mapped with healthcare, which is going to happen. So this region, for this region, Dubai will become a business class medical tourism destination. So coming back to supply and demand situation, which your question was, I think there is huge potential in this region.
So anybody who was wanting to look at investing in healthcare in UAE, Dr. Raza says there's a lot of potential. So start looking at your business plans for the same. Now, if you were to be a fortune teller and predict the future of healthcare, what do you foresee regarding these three prophecies? The first is increased dependence on home care and hospitals reserved only for critical care, more of single specialty formats over multi-speciality care, and multifold increase in penetration of technology in the form of AI and ML into healthcare.
I think, Prashant, this is precisely what COVID experience has taught us. Like, I will give an example. I'm looking at purely from UAE angle, and which is applicable everywhere. Now, the 70% business which was coming from outpatient. Imagine we had a telemedicine mature system with insurance approval and payment pathways well designed. So this 70% people who suffered at home could not come to hospital, and the healthcare providers, the specialists and the consultants who were sitting at home jobless could have continued to provide services, and people could have continued to take benefit. Because with the technology now, you can have a live conversation, live transmission of reports, and live examination of the patient. So technology is so advanced. So point number one, the lesson learned from COVID is that I think on every forum it has been said that the biggest accelerator to technology has been COVID. And same is healthcare. Because you and me who have been into this business have seen that telemedicine has been used for decades as only a marketing tool. But the real use of telemedicine has come during COVID times. So this is a very good realization and consciousness in this area. So a lot of people have moved into this, insurances have accepted it, payment pathways have been established, and the growth which we see in telemedicine is extremely good, but it is going to grow. Number two, as we talked about single specialty, we have discussed earlier, if it was there, the entire ecosystem of healthcare which has collapsed and suffered a lot would have survived these times, because all these people would have confidently gone into single specialties and continue to take required treatments. Like especially cancer patients have suffered a lot, cardiac patients have suffered a lot. Lot of people with a lot of genuine urgent orthopedic procedures could have gone to these places. So I think, people don't go into single specialties because of one confusion, that there is no critical mass. But that's a myth. And I see some of the good institutions, even in Delhi, who started as dedicated cardiac services, got confused and moved into multi specialties. This to people like us who have spent our life into meaningfully into healthcare is not good, because you have created a niche for yourself and there is enough business, there is critical mass. Why are you getting into stereotype and Me Too mode of moving into multi-specialty? So I think everybody has to relook at it. And like, for example, your Center for Sight, Dr. Mahipal has done so well. And he has shown to the world that how ophthalmology practice standalone could be done so successfully. And these are some of the models which through which people have to learn and move on. So I think that is number two. And third is home care is again very, very important. COVID has been a big accelerator, although the home care concept has been there for some time. But again, big acceleration has come through COVID, because home ICU, home care, home physio, and a lot of other things. I think there is a big potential because of the aging population, and cost of healthcare is so high because of the high infrastructure and technology cost in hospitals. So a lot of people would be managed at home, and especially in India, it is very important because of our value system. And I will not say respect, I will say more emotional approach towards our family system. So people in the home environment, if they could be provided the same care which is expected to be provided in the hospital, I think there's a great future for home care. So I think whatever three subjects you talked about, all of them we have had more realization about their importance during COVID times. So perhaps they will also offload the rush in the hospitals, because a lot of services could be provided away from the hospital. And actually, people who need not go to hospital should not go to hospital. If it could be avoided, it should be avoided. So this is the approach where technology can work, home care can work, and single specialty will support it in many ways.
So as we look at timelines of BC and AD, I think even healthcare will look at before COVID and after COVID. And as you have rightly said, a lot of these changes are getting accelerated, and the future will see them in a much more structured manner, not in a rudimentary manner kept as just as a marketing tool, as you mentioned, but genuinely there to provide people the care away from hospitals. That's wonderful. Now I'll come back to your favorite area of marketing, and wanted to get your insights that, especially again post-COVID, do you see digital marketing to totally dominate other spends like conventional marketing in the coming years in healthcare?
I think so, because this we have seen now. Like, for example, I'll give you a simple example. We used to spend so much money to be on third, fourth page of a newspaper. That's totally gone, because newspaper is gone. Who could think of that the morning physical feel of newspaper will no longer be there? And we are a generation, we have seen both, but the new generation is not used to it. So the stereotype, typical marketing rules have to change, because everybody is on social media, Facebook, Instagram, Twitter, and we have to move with the times. So I think the social media, and second thing is in typical stereotype marketing, the option and opportunity of customization was not there. It was mass marketing. Today I have the option of customizing an approach for Prashant, which he will relate to. So this is changing the rule of the game of marketing also today. So the future is only digital marketing. Like as we talked earlier about, like CMEs have changed. Now, a lot of awareness campaigns, and actually, again, you can customize solutions, you can customize messages, and you can choose the timing of sending a message. You can choose a timing of engaging a person based on his best available time slot. I mean, these options were never available in conventional marketing. Imagine a hospital marketing person going to a doctor and waiting for him to be available and wasting so much time. Today, you have the option of, based on the availability and best convenience of that doctor, you can engage with him digitally. So I think, as you said, post-COVID, the rules of marketing also will change, but for better, because technology has helped us in so much customization. So as we talk about personalized, individualized, customized approach, that is possible through digital marketing, which was not there. I'm always a propagator of opportunity in adversity. And this is what I call adversity quotient management, because we talk of intelligence quotient, emotional quotient, social quotient. But in these times, it is adversity quotient. So in these adverse times, so many innovations have come up, which are going to be very useful going forward. And digital approach is one of them. So coming back to the same, to repeat the same thing which everybody has said, that the biggest accelerator of technology has been COVID. So this has been the positive outcome of COVID.
So as you said, the future is digital.
Yeah,
and I think the ones who don't accept it will be left behind, and who remain stuck to the conventional methods will suddenly see patients not entering their hospitals. So I can actually speak on everyone's behalf that today was a masterclass in healthcare marketing, and we all shall preserve the pearls of wisdom that you have shared with us. Shout out to all the viewers for their continued support of this channel with views, likes, shares, and subscription. And thanks a ton, Dr. Raza, again for doing this. And until we meet again, stay inspired, stay safe.
Thank you very much, Prashant, for this opportunity.
It's a pleasure, sir.
Thank you very much.